Welcome to A Healthy Dose. You've likely heard a friend or family member use the phrase, my therapist says. It's a statement that you never would have heard of used publicly or even with pride 20 years ago. It's fantastic that the stigma around therapy is starting to fall away. But is this just a trend or is there something deeper going on? What is therapy really about? Does it actually help? And how do we know which kind of mental health professional is the right fit for our specific situation? When someone decides to reach out for support, it can be incredibly overwhelming to know where to start. You've probably seen titles like psychologist, psychiatrist, psychotherapist, counselor, or social worker, and wondered, what's the difference? Joining me today to help demystify mental health support is Sherry Campbell, a registered psychotherapist and social worker with over 25 years experience in the mental health field. Sherry, thank you so much for joining us today.
Thank you.
So let's jump in and let's start with those definitions. What are the different types, starting with counselors? What is a counselor then? What do they tend to focus on?
Yeah, a lot of the differences can appear subtle, but they're not, right?
Okay.
That's what's really important to know. I know it can be confusing when
Yes,
people
very
first get
confusing.
started, right? So often we think of counselors as in the community, right?
Mhm.
Community counselors, like say, for example, guidance counselors that we've met when
Right.
we were teenagers
Yeah.
in school, or they can work for community organizations. And they often have a BA or a college level education, and
Okay.
they're excellent supportive counseling services to help us make referrals, to help us with careers and all kinds of those things. Not qualified, however, and they're the first to admit it, which is awesome, in mental health disorders and
Okay.
into deeper therapy techniques.
Okay, so let's move on to social workers with their clinical training, therapy. How do they connect with the community resources?
Okay, so social workers, that could be the same kind of thing. You can see BA, so with the
Okay.
Bachelor of Arts social workers that
Okay.
work in the community as well.
Yeah.
And they provide a lot of the similar services as counselors, right? Can work in hospital settings and community settings in supportive ways. Masters of social work, right? And registered psychotherapists actually often do very much similar types of work
Okay.
together.
I was thinking with counselors too, that probably that category may also go for like spiritual counselors maybe as
Yes,
well. Is that
exactly.
possible?
Yes, for sure.
Okay.
Right. And so needed and so valuable. And I receive a lot of referrals from counselors who say, listen, I'm working with somebody, they're, an amazing client, but I think that they're struggling with something perhaps a little bit deeper. Can you work with them as well? Right. So we
Okay.
were, an adjunct service, right?
Yeah.
And so when you're masters of social work, right, or registered psychotherapist, then we are working with mental health disorders or some challenging emotional challenges such as,
Okay, so you got counselors,
grief
you got
and
the social workers, and then the psychotherapists. Then you're dealing
that's
more with
right.
the mental health.
That's right. I know it sounds confusing.
Yeah.
And some social workers, like the masters of social workers, right, can also provide psychotherapy. So it has morphed over the years. It's not as clear
Okay.
cut as it used to be. So often when people are looking for services, their benefits, for example, will often say, well, my benefits cover masters of social work and not a registered psychotherapist, or vice versa.
Oh my goodness.
Right? I know.
Oh, we'll get probably more into
Yeah.
that too. But okay, so now a psychologist and a
Yes.
psychiatrist.
Okay, now a psychologist is a PhD in psychology. And they also provide talk therapy, but they mainly usually apply for diagnosis and they do psychological assessments. So when I'm asking for, like an IQ assessment or a spectrum assessment or a more in-depth personality evaluation, they have very detailed reports and intensive techniques that can help aid us in our treatment plan.
And a psychiatrist can
Okay, and psychiatrist is in the medical field. You are referred to a psychiatrist through your family doctor, and that is through OHIP. And what they primarily do, very, very few, some do talk therapy, but they clearly use the DSM-5, right? The diagnostic manual, the statistics manual.
What's DMS-5?
I know.
What is that?
It's like a manual where they can more clearly diagnose, and the psychiatrist will then prescribe medication if necessary. Psychologists and social workers and psychotherapists and counselors, we do not prescribe medication.
Okay, we just covered a whole mouthful there.
Right?
So there is a lot, and there's like a whole range here. So we've just barely defined what each is, and we're going to go into detail about where to maybe.
It's a lot.
Yeah, it's a lot for each
person.
Which one should we have? So stay with us. We'll try to unpack more of what would be beneficial depending on your own case, personality, and situation right after the break.